In Doctor on Call, we believe that healthcare is universal. Everyone should have access to good medical advice regardless of their locations.
So during my many years of medical practice, more often than not, when we get a certain sign or symptom, not many people actually go and immediately investigate it.
At Doctor On Call, you can get connected to our network of doctors and specialists within minutes through any mobile devices, whether you're at home, in the office, or on the go.
The platform is designed so that patients can easily find the right doctors. For the doctor, we ensure that the platform is safe, secure, and they can very simply manage their patients via remotely or even in person.
By having this teleconsult, patient can actually have a continued medical care, and this can actually save their life.
As the pioneer of telehealth in Malaysia, we always believe in closing the patient care gap through telehealth. For instance, our newly launched Doc at Home service would enable patients to book physical screening and lab diagnostic from the comfort of their homes. And this is especially crucial during this time of pandemic, where we want to keep our parents, kids, and loved ones safe.
So the platform is simple enough for doctors like us to go online, do a medical consultation in between our physical patients in the clinic.
In future, this is the way forward toward looking towards the telehealth and management, where we can overcome a lot of difficulties.
Now, as far as I am concerned, I can give uninterrupted medical advice to them. Isn't that easy for both parties?
During these difficult times, we strive to ensure that everyone stays safe without compromising their need for medical care, medication, as well as other healthcare services.
And also we can prescribe some of the initial medication online. So the patient can get treated to a certain degree before they come and see a doctor.
Our vision is to reshape and redefine healthcare. We believe in the power of technology to create better patient experience and continuity of care. We design our service for the patients to get the right service, right treatment at the right time.
During a pandemic like this, it is important not only that we should ensure the safety of patients, but healthcare professionals and doctors as well. Gone are the days where patients wait for hours in a long and busy clinic. These days, we want a seamless experience. Get an appointment booked online, see a doctor at the shortest possible time, and then get going with life.
We have never had something like this before. Upon doing the services, the patient will actually get their blood test done at their home, and the doctor is able to review their blood tests via Doctor On Call platform, or if required, they are called into the clinic. So that's pretty amazing if you ask me. You don't actually need the patient to come twice, one just to take blood and then come again. So it's very convenient for the patients, and my patients are very happy. Hello, good afternoon, ladies and gentlemen, and salam sejahtera. Welcome to our webinar today entitled Female Infertility. So it's a very interesting topic today. I'm Dr. Sashini and I am your host. All right, ladies and gentlemen, I see so many of y'all today tuning in. Kindly tell me your name and where are you tuning in from in the chat box. All right, tell me where you're tuning in from. Today's webinar, Female Infertility, is specially brought to you by Malaysia's largest telemedicine platform, Dr. On Call and Thomson Medical Center. All right. So yes, let me see. Guys, can you all tell me where you're streaming in from? Tell me where you're from. You can use the chat box to tell me where you're from today. Yes, both male and female, all allowed to join, no problem. All right, Lukesh from KL. Who else is there? Welcome, Lukesh. Hello, Alia. Hi. Tell me where you're from. Where are you streaming from? Hi, May. Hi, Jen. Mel. Nice to see all of y'all today in this afternoon. Huh? Yes, good afternoon, Wafia. Muhammad Haidir from Seremban. Fantastic. Wow, people from Seremban also streaming in. Huh? Not bad, not bad. Welcome. So we've got a superbly interesting topic today. Like I said, it's female infertility. Gone were the days where ladies easily used to have 5 kids, 10 kids, 15 kids and counting. You know, it was no issues, you know, about maybe 10, 15 years ago. But today we've got a situation where there is a rising concern of female infertility. This is based on certain statistics. Statistics says that globally, it is estimated 48 million women are affected with infertility. Very scary, yeah? Scary statistics. Hi, guys. Oh, Nurul Huda from Perak, Amisha, Janet Lee, Zara Umaira, Wafia from Sabah. Fantastic. We've got people from Sabah over here. Great, guys. Kamarul from Sabah. Wow, looks like we've got the whole Malaysia, East Malaysia, West Malaysia. Fantastic. Thank you for tuning in. So, ladies and gentlemen, we've got a very special guest speaker today. People from Johor Bahru. Hi. Shafika. Eka Shafika. Hi. So we've got a very special guest today. She is a consultant obstetrician, gynecologist, and fertility specialist based in Thomson Medical Center Fertility and Women's Specialist Center in Ipoh and Penang. She has obtained her Master's of Obstetric and Gynecology from University Malaya in 2007, and subsequently she went to subspecialize under the Ministry of Health, Reproductive Medicine subspecialty from 2012 to 2015. And that's not all, guys. She also did her fellowship in KK IVF and KK Women's and Children's Hospital in Singapore in 2013. Yes, ladies and gentlemen, I hope you're ready for this very special guest. She is none other than Dr. Liza Ling Ping. Can we give her a big round of applause and welcome? Welcome, Dr. Liza.
Hi.
Hi, Dr. Liza. We're all very excited to actually see you today. We've got lots of questions for you. So, Dr. Liza, can we begin with some of our questions that we actually already got from the audience?
Yes, sure.
All right, ladies and gentlemen, I hope you're ready for this. So while we are going through this, please take time to share, like the webinar, and also tag 3 of your friends. During this session, if you can tag, like this webinar, and also tag 3 of your friends, you will be entitled to free lunch all the way from KFC. That's right, ladies and gentlemen. Tune in, tell me where you're from. Also drop in your questions, right? So, Dr. Liza, we've got a whole list of questions for you today. I hope you don't mind. All right. So the first thing we want to know is, what is the commonest cause or most common cause of fertility? And what is the rate of infertility among Malaysian women?
Okay. Probably I'll answer the second one first. Okay. So if you look at the global infertility rate, is about 12 to 15%, right? So Malaysia, we are not that far off. We're also hovering around 11 to 14%. Okay, so actually we will say we are on par with the international level, right? Okay, so what's the most common cause of infertility for women? Would be failure to ovulate. That means you don't have any ovulation for that month, right? So failure to ovulate can mean 2 things. It's either you have a lot of eggs, but they fail to grow and ovulate, or your reserve is so low that you do not ovulate anymore. So for the first one, like those with a lot of eggs, but they fail to grow, more commonly seen in those with polycystic ovarian syndrome, or in short, we call them PCOS.
I see. Okay. Thank you for that. The second question is, this is a very common question. A lot of people are actually quite afraid of it. Telephone bimbit. Does that, or even laptop, okay? Laptop or telephone or handphone, does that contribute to infertility?
All right, there's a lot of hypes about the radiation from mobile phones or any mobile gadgets, okay? Right. There's a lot of studies done on male fertility, and it does show that those male with borderline sperms, it do affect them, right? But then for female fertility, we don't really see much studies on human. There's lots and lots of studies on animals, on mice, on rats, but so far I've not come across a study on women. So if we extrapolate that, in mice and animals, they show that it does affect their eggs, the quality of the eggs, the DNA part of the egg. So it does reduce the fertility. So if we extrapolate that to human, I would say it may affect us, but we don't have a study or clear data to show that. So to be safe, I mean, we can't, in this world nowadays, I'm sure all of us have a handphone. Some have 2 or 3. So we can't live without a handphone. The only advice is try to minimize the usage. Don't, the moment you wake up will be handphone, before you sleep will be handphone, right? Try to minimize. We can't live without it nowadays.
That is a very interesting thing. I'm sure everybody over here will be like, oh my God, how many hours I use handphone, how many hours I use laptop, you know? Yeah. But interesting, it does contribute to male infertility, yeah? For those who are already on low...
it does affect those with borderline sperms, yes.
Okay, all right. So, good note to take. I learned something. So, the next question is, can STD cause permanent infertility, sexually transmitted disease? Okay, can it cause permanent infertility?
Okay, it can in female, yes. Okay, so STD, the common one is caused by a bacteria that's called Chlamydia trachomatis, all right? So this bacteria actually cause an infection, and if this infection ascends up to our reproductive tract, means the womb or the fallopian tubes, right? So it causes inflammation, infection, then later on scarring. So when it causes scarring, it may scar the tube, or it may cause the tube to be swollen with fluid and all, so damaging the tubes. So if both the tubes are scarred, both the tubes are damaged, so your tubes may be blocked. So if your tubes are blocked, then to get pregnant in a natural way would be almost impossible. So that's what we mean by almost permanent infertility.
What, if you don't mind sharing with us, what are the commonest STDs that has led to these kind of situation?
Like I said, infection by chlamydia, right? So this is the most common cause of it. Okay, but not all women with chlamydia will end up with tubal factor infertility. So about 10 to 15% of women who has chlamydia infection may have what we call as a pelvic inflammatory disease. So this PID in short, and about 15% of these women may end up with tubal infertility. So it's not that if I get chlamydia infection, it's a sure sign that I'm infertile. No. All right.
Okay. All right. Thank you. Okay. Now, this is also a very famous question. You see people going around telling each other. So, smoking is a pretty common thing in Malaysia, both in males and females. How much smoking is too much smoking? So much so that it affects the fertility.
Okay. I'm sure that all of us know that the doctors always tell you smoking is very bad. Okay. Whatever the amount, okay? So for a woman, I would say even 1 cigarette smoke is too much, okay? Why? Because if you smoke, let's say only 1 a day, the amount of the chemicals in your cigarette smoke will actually damage your eggs, right? How do they damage them is they increases the loss of your egg, the rate of loss of your egg. So once your egg is lost or it dies off, we as women, we cannot regenerate new eggs. So in a way, you're losing your eggs faster than the non-smokers, right? So that's how this cigarette smoke may damage the egg. And it is also known that those who smoke, they have less chance, the chance of getting pregnant is twice as less compared to women who don't smoke. Either you try naturally or you go for assisted treatment, okay? And you are asking how much, I would say even one cigarette smoke is not good, right?
Is this applicable to passive smoking as well?
Yes, definitely. Even that you don't smoke, you're among friends who smokes, or you have family members who smoke. As a passive smoker, those with who are exposed to cigarette smoke, we do find that their fertility rate is lower as compared to those who are not exposed to cigarette smoke at all. Yeah.
Okay, thank you. How about sugar consumption? You know, if there's too much of sugar in our food, now, you know, Malaysian food, we've got fantastic food, you know, different culture, we've got different cuisine, you know, with mama and all that. So does high consumption of sugar affect female fertility?
In fact, yes, right. High consumption of sugar is normally how it affects our female fertility is by what do you call it? It causes a imbalance in our body, right? So this high consumption of sugar will actually cause the hormonal imbalance in our body, and it also will it actually will also damage our eggs in terms of the DNA part of it. So you will find that those women who has high blood sugar level, where we call them diabetes, right? So these women, they are actually less fertile as compared to those who have no diabetes. It's because of this that even the number of eggs that they have sometimes are much less, and the quality of the eggs are poorer. So with this, for them to get pregnant is more difficult, right? So there are some people say, there's a study that shows that even if you drink a sugary drink every day, right, the chance of you, it reduces the chance of you getting pregnant by 25%. So that shows how bad the sugar drink is to us.
Oh my. Okay, ladies, take note, okay? Cut down sugary drinks, no Coca-Cola, okay? All the pastries, all time to cut down.
Yeah.
25% is very high.
Yes.
How about soy-based products? Is it good for female fertility? A lot of people said soy-based is good. So does that help?
Okay, previously there's a lot of hype about this soy-based, we call them phytoestrogen, is because they mimic our own body estrogen that we produce ourselves. Okay, so a lot of advice last time that because they say if you take a lot of soy, it's very difficult for you to get pregnant, right? But then there are a lot of studies that's been carried out after that, and there's one recent study that shows that they have this group of women where they give them different type of supplements in order to help them get pregnant. And one of the supplements actually contains soy, and it's of course in a moderate amount, in the measured amount. And they found that this group of women actually has higher pregnancy rates, higher live birth rates. So my advice is, if you're going to take something, take in moderation. Don't take too much, because too much is never too good. So if you ask me whether soy is good for pregnancy, I would say in moderate amount, yes, according to whatever that's your doctor advised you.
So take note, guys, too much and too little of something is not good, okay? Go with moderation, all right? So, okay, that's about food. How about people who are overweight or underweight. So we've got women in two categories. It's rarely in the middle. It's either we are overweight or we are underweight, and they're not able to control their body mass or weight. So is there any medical intervention or any treatment that we can do in terms of their fertility?
Okay. For us to say that you are underweight or overweight, there's always this how to measure it. Okay, so we go by body mass index, or in short, we call them BMI, right? So if your BMI falls between 19 to 24, then you're within the normal range. If it's above that, then you're overweight. If you're above 30, then you're actually in the obese category. So those who are below 19, then you're considered underweight, right? So it's two different groups of people and two different treatments. So I'll start with the overweight first, right? So for those who are overweight, normally this group of people who are underweight or overweight, they may have problems with their menses. The menses may not be regular. So if the menses are not regular, probably they are not ovulating every month. So that's when the problem will start already. Okay. So for those who are BMI which is higher, medical intervention definitely will start with your doctors will always tell you have to have lifestyle changes. That's definite. I know this is a bit naggy, but do take heed. We need a healthy lifestyle. We need good diet, and definitely we need exercise to improve our body. Then only medical intervention will help. Without the first three, sometimes medical intervention may not work, right? So in terms of fertility, what are there available to help you, right? Medication, you can be on medication or injection to help you to ovulate every month, because like I said earlier, most of them will have problems ovulating. So we will give you pills to help you ovulate or injections to help you ovulate every month. So that is not to worry. But it's the first three that we will try. We really need help from you yourself as to make sure that your subsequent treatment will be very, very good and the outcome is good. Okay, and the same goes for those who are underweight. Those who are underweight, they also may fail to ovulate because the menses sometimes will stop, right? So of course, to bring them back up to the normal BMI, right? You will need to eat healthy lifestyle, right? Then only from there, if you can bring your BMI back to normal and your body recognizes that you're well, you sometimes do not need any medication. You start to ovulate spontaneously on your own.
Thank you for the detailed explanation, Dr. Liza. So guys, it starts with us lah. The treatment starts with us. It's dietary. Dr. Liza, there's a question from YouTube actually. Someone from YouTube channel actually has asked us, how do you know if your tubes are blocked?
Okay, there are ways to check to see whether your tubes are blocked. Okay, so you will need your doctor to help you. So it will involve a very small procedure to check to see whether your tubes are blocked. There are a few ways. Either you do an X-ray, which is what you call as a HSG or hysterosalpingography, right, to check to see whether your tubes are blocked. Or the other way is through an ultrasound. We call them hycosi. So that way also to know to see whether your tubes are blocked. So that is the only way that you can check to know to see whether your tubes are blocked. The last one is more invasive. It's usually through a surgery where we perform a laparoscope. Okay, means we put a camera through your belly button, right? Then we will inject dye into your tube to see whether they are blocked or patent. Yeah. So this is, so you have to see a doctor to know that. Normally through a normal scan. Okay, sometimes I get couples who come in, patients telling me that, oh, I had a scan and my tubes are okay. But then when I ask further, the scan is just a normal gynae scan. So sometimes normal gynae scans are a little bit difficult to see whether your tubes are blocked or not, unless your doctor has done a hycosi with that scan. Yeah.
Okay, thank you so much, Dr. Liza. There's another question. Can coffee consumption reduce fertility?
I wouldn't say coffee consumption depends on how much coffee consumption. Okay, if you're a person who loves coffee, 1 to 3 cups a day, not an issue, right? But those who say that if I drink 7 to 8 cups a day, then that's a bit too much. Okay, so it doesn't really affect fertility, but it does help affect your health, right? Too much caffeine is never good for us. Yeah.
That is the best thing I've heard today, because I'm a coffee lover. I cannot possibly imagine 1 to 3 cups. Okay, I'm still safe. So for Ruby, who asked that question, you got your answer. Okay, 1 to 3 cups, you're safe. Nothing more than that, all right? So going back to the questions, is there any early signs of infertility in women to say that, you know, okay, there might be a problem? Is there any early indication or sign?
Okay. Still goes back to your menstrual cycle. Okay, for ladies, the important thing for us, we know our menstrual cycles. If your menstrual cycles comes right on the clock every month, then you're pretty sure that you're actually quite fertile in a way that you're ovulating, right? So for those of you who has irregular, abnormal menstrual cycle, means your menstrual cycle comes once in 2 months, some 4 months once, 6 months, then you know that you may most probably you're not ovulating. So those are the early signs already. Okay, so that's one. Number 2 is during your menses, do you have a lot of menstrual cramps, menstrual pain? Even before your menstrual starts, you already have pain. Even after your menstrual finishes, you still have pain, right? So painful menses also may be a sign, because these are associated with women who may have endometriosis. Endometriosis is a disease of the womb that causes infertility, may cause infertility. So probably those who have this will want to get it checked earlier, so that they are more aware that we can control your symptoms and you can control the progression of your disease. It's very difficult to treat endometriosis, right? So what we want is to control the disease at the early stage, right? That's one. So the others is you have failed to get pregnant, all right? Even trying for 1 year, right? It's really showing that there's some problem. So do go and see your doctor early. Those are the early signs. Yeah.
Okay, thank you so much. So just a recap on that, guys. If you're having irregular menses, okay, or painful menstrual cycle before and after the menstrual cycle is over, and also delayed getting pregnant, you know, more than a year and you're still delayed. So those are among the signs, you know, to show that you might be having a infertility problem. All right. So moving on. There is a question about irregular menses. Are irregular menses or periods a sure sign of infertility? Is it a sure sign, or could it be some other problem?
Okay. It's not really a sure sign that you're infertile. Okay. A woman may end up with irregular menses. Probably is because they have other hormonal problems or endocrine problems that leads to them having irregular periods. The most common is thyroid problem. For women, thyroid problem is quite common. So normally we will check them for thyroid, either the thyroid hormone is too high or too low. So that also would lead them to have irregular menses and them not ovulating. So treatment for them is very simple. Just treat the thyroid. If the ones that are stable, they're ovulating on their own, they can get pregnant on their own very easily, right? So the other problems is a prolactin hormone. Okay, prolactin hormone is a hormone that produces milk. So for mothers who have delivered, they will start producing milk. Is when the prolactin hormone starts coming up. Okay, so women who has high prolactin level also will fail to ovulate. So with that, their menses may become irregular. So if you treat their hyperprolactin level, means the high prolactin level, once it's normalized, they will regulate and they will get pregnant on their own. So not all irregular menses means infertility. So it may be because you have some other medical conditions that causes your hormones to be imbalanced, causes you not to ovulate every month.
Okay, thank you, Dr. Liza. So we're going to mix it up a little bit more because some people have requested, come we speak in Malay. Boleh lah, bahasa Melayu pun boleh, tak ada masalah. Okay, so just to recap, just irregular menses doesn't mean it's infertility. Boleh jadi sebab masalah thyroid, boleh jadi sebab prolaktin tinggi. Okay, lepas bersalin kita punya hormon prolaktin tinggi, so disebabkan prolaktin tinggi juga boleh menyebabkan irregular menses lah. Okay, doesn't mean it's infertility problem. Alright, so thank you so much. I'm going to address some question from the audience. Okay, so what are the supplements to increase ovarian reserve? Supplements untuk meningkatkan kita punya ovary the ovary punya reserve.
Okay. Sadly, there's none. Memang tak ada, okay? Sebab wanita memang tak boleh membentuk telur yang baru selepas dilahirkan. Okay. Tapi apa yang kita boleh buat ialah untuk sikit sebanyak untuk memperbaiki kualiti telur yang sedia ada, right? So how do we memperbaiki? We have to go back to healthy lifestyle, healthy diet, and exercise. Okay, of course there are some supplements yang you can makan, right? To help improve the quality. There are a lot in the market. I mean, normally the one that study has research on and shows some data on it, coenzyme Q10, right? L-arginine. A lot of us are lack of vitamin D3. So these are the few supplements that normally I'll ask my patients to be on, right? So it doesn't mean that by taking this miraculously your egg will be 100% okay. So we are just trying to improve. But whatever it is, what is very important is your lifestyle.
Okay, thank you, Dr. Liza.
Lacking.
Guys, it goes back to your diet and lifestyle. Okay, let's get back to basics. I hope you all took notes. CoQ10 and then arginine. Those of y'all who want to know the supplements that can help. All right, it's not a for sure thing, but can help. All right. Next question from Ellen Lau. Profortil is costly, Dr. Liza. Got any cheaper replacement or not? More economical?
Yes, but you will have to take many tablets. Okay. I'm not promoting Profortil. I don't have any share in Profortil, but what I like about Profortil is that one tablet that you take every day, day and night, okay, contains whatever that's needed for the sperm. Okay, well, if you say you want a cheaper option, you just go out and buy different contents. All right. Sometimes the cost may come out to be almost the same, just a little bit cheaper, but the number of tablets that you need to take one day is quite a lot, right? So unfortunately, no cheaper option.
Okay,
tablet to tablet, no.
All right, thank you so much, Dr. Liza. Ellen, I hope you've got your answer. There's one from Putri Salju. So she's like, okay, can you just list down for me what could be the causes of infertility?
Causes of infertility, okay. You divide them to female first, okay. The first is your you failing to ovulate. That's number one. Okay. Number two is you have other medical problems that causes you to fail to ovulate, right? And number two, to see whether your tubes are fine, are they patent, are they blocked, are they swollen, right? Are they diseased, right? Then number three, your hormone profiles, right? To see if you have any other problems. So these are the three main ones that I will say that you need to look into first. Okay, so if you look at male infertility, right? So male normally is either the sperms are not enough, the sperms they don't move fast enough, or the normal sperms are very few, or there's no sperms at all. Okay, so these are the common causes of infertility. Of course, there are other causes like premature ovarian failure, right? Those are very rare causes, right? Or you have medical conditions causing you to be on treatment. The medication causes you to be infertile. Those are the other causes also. Yeah.
Okay, thank you. I hope that answers your question, Putri. We've also got one from Mr. Maran. What is the best way to diagnose infertility, and how do we find out the problems and severity?
Okay, the best way to diagnose infertility, if you are married, unprotected sexual intercourse 1 year, you still fail to get pregnant and you are below 35, okay, that is one way of knowing that you have problems getting to conceive, okay. That's your one sign, okay. So the best way is still you have to go and see a doctor and get it checked out, right? I know a lot of people wants to go through internet and search for this cause and that cause, but a lot of my patients, they do the same also, but in the end they will still need to get it checked to know what is their problem actually, what is the root. Is it your female or the male, right? So at least you know where what is the exact cause of it, right? Okay.
All right.
What is the second part of the question? I can't remember.
How do we find out the problems and the severity? How to diagnose the infertility and how to find out the problem and severity, the cause and the severity?
Yeah. So the severity depends on what is the cause, right? So there are severity can be from sperm severity, or it can be from your endometriosis severity. So there's a lot of things to explain. So I would actually say that the best one is still go and see your doctor and get it checked. So at least you know the root from it, the root cause. Then from there you can pay attention more to that.
Okay, thank you, Dr. Liza. So, Mr. Maran, no Dr. Google. You have to meet the doctor, the obstetric or gynecologist, and find out what is the problem. You know, nobody has the same problem. There's no two person can be diagnosed with the same thing or the same exact situation or the same exact cause. So the best way to know is to meet your gynecologist and find out further investigation and management accordingly. All right. So, wow, there's really a lot of questions, Dr. Liza. You know, you are like on a roll today. There's so many questions from the audience. This is from Ezrin Muhammad. Is there a way to preserve or prolong your prime fertility window on? This one very famous question, especially for people who want to focus on career. Today we are all very career minded. We want to delay, you know, starting a family because we are so focused. So is there a way to preserve or prolong?
Okay, so your prime fertility period, okay, women, please do take note, is when you're around 25 to 29 years old. Why? Is because that time your egg is the healthiest. The babies that you form is more normal. So women at this age group, when they try to conceive, most of them will have no problems getting pregnant, conceiving, and most of them will deliver a healthy baby. So that's your time. So you're asking, is there a way to preserve it? Right. Unfortunately, we don't. There's no medication to take to stop your clock from ticking. Right. Your biological clock will continuously tick. Right. There's no way to stop it. But there is a way whereby there's we call it social egg freezing. Right. Means you will have to remove your egg from your ovary and freeze it so that the time for the egg stops. But this, you will have to go back to your culture and your religion and the in the law in the country whether it's allowed. Okay, so I know for Muslims, if you are not married, then that's not allowed. Okay, but for other races, that's fine. So this is what we call as egg freezing.
And how long does this egg freezing last, Dr. Liza?
It is as long as until you're ready to use it, until you're ready to start a family. Yeah.
So that is like maybe 10 years down the line still can be used?
Yeah.
Fantastic piece of info. Thank you, Dr. Liza. So we've got one more from Kogila Jayaraman. Hi, doctor. Can we conceive naturally after removing one tube? Okay. Kalau kita dah keluarkan one side tube sebelah, kita kan ada dua tube, kita keluarkan tube sebelah, boleh tak mengandung normal atau kena guna IVF or IUI?
Okay, so if you already have one tube removed, because I saw that because of ectopic pregnancy maksudnya mengandung luar rahim lah, kan? Right. So yang pentingnya sekarang is ialah kena check dulu tengok yang tube sebelah lagi normal ke tak normal, berfungsi ke tak. Right. So kalau tube yang sebelah lagi berfungsi dan is working fine, yes, you can always try for a natural conception. Okay. Unless the other tube is also affected, then probably natural conception, the chances will be much lower. Then you will need to seek help with either through IVF, right? Yeah, IUI will still be a natural way. The chances will not be as much.
Okay, thank you. This is from Norman Ng. What are the causes of missed abortions?
Okay. Missed abortions, the most common cause is the baby itself is not normal. So the baby may be able to implant, but because the baby is not normal, it doesn't grow to its full potential. So that's the most common cause of missed abortion, right? The other causes are probably medical problems, which is one that's more common, what we call is antiphospholipid syndrome or thrombophilia disease in the lady. So that's one. Or the third one, some underlying medical problems, meaning you are diabetic, you didn't know that you're diabetic, your blood sugar is really, really high, or you are having some endocrine problems like thyroid disease that you're not aware of. So that missed abortion actually leads to that diagnosis. Yeah.
Okay, I'm going to take another one from Sally Ibrahim. Is taking contraceptive pills for too long, contraceptive pills for too long decrease the chances to be pregnant?
No, it doesn't. It may decrease, it may take your cycles some time to regulate back, right? But it doesn't decrease your fertility rate.
Okay,
right?
So for those of y'all on contraceptive pills and, injections, it's okay, no problem. Family planning, y'all can plan properly. It doesn't affect fertility. All right, guys? So I'm going to go back to my questions and I'll get back to yours after this. So, Dr. Liza, polycystic ovarian syndrome, just now you mentioned about PCOS, is becoming more prevalent. I've been in practice for about 10 years now. I rarely used to see it last time. Now, almost so many women, you hear PCOS everywhere. Is there any way to avoid it?
Not entirely. Because some PCOS, they are actually genetically acquired and they run in family. So these are the ones that you can't really avoid. Okay, but talking about PCOS, most women affected by PCOS, they do have issues with their weight. They are usually a higher BMI. So those with higher BMI, these are the women that we can try to correct them. So by bringing the BMI to normal, right? Of course, again, healthy lifestyle, diet, exercise. Those are the ones that we can sort of like change their lifestyle, manage their lifestyle, regulate the menses. So once the menses regulate, they will be fertile. Okay, but there's another group of women where they are also PCOS, but they are known as the lean PCOS. So they are already very in the normal BMI, but the hormones are the one that's not normal. So these are the women that may depend on medication to help them ovulate or to help them get pregnant. Yeah.
Okay, thank you. So this is like the most common question. What is the optimal age? Umur yang sesuai untuk dapatkan baby?
Yeah, okay, like I think I mentioned this now earlier, right? The data that shows that the ages between 25 to 29 years old. Why is because this is the time where your egg is the healthiest and the babies that are formed has very high chance of it being normal. That means you're going to deliver a normal baby. So this is the optimal age for a baby. Yeah.
That is up to 29 years old, right? The optimal age.
Yeah, because after 30 years old, your egg will start reducing. Our egg reserve, we have our egg reserve, right? After 30, the graph will start falling down. Okay, so it will gradually drop down. At 35, so you hear this magic word all the time, magic numbers 30, 35, 40. So at 30 to 35, you start dropping very slow. At 35, you drop even more steep. At 40, you zoom down more. So be careful, be mindful, those above 35 and 40. So that's when the egg quality will start dropping and the numbers of the eggs will start dropping more.
What would you say is too old or too risky? Like memang that age already tak boleh conceive lah. Better not to.
Okay. There's no, I wouldn't say too old is, there's an age limit to being pregnant. I'm sure we have read on the news that women who are 60 years old are getting pregnant, right? Okay, but if you look at it, these women who are of older age, like if we say above 45, they themselves will have some medical problems or background medical problems already. So if they are going to be pregnant, then all these pregnancy-induced medical problems would be even more. For example, pregnancy-induced hypertension, and number 2, pregnancy-induced diabetes, right? So these are the 2 main problems that we normally see during pregnancy. They may worsen during pregnancy. So it may actually affect the mummy who is pregnant and the baby, the outcome of the baby, right? So there's no one cutoff age to say that you are, it's too risky. It depends on how you are when you want to get pregnant and what other medical problems you have during that time, right? And for those who are older, it's not the problem of them being pregnant. Problem of getting them pregnant would be the biggest challenge.
Understand. Thank you. In fact, having said all of this, I mean, probably that is the situation now because most women are also career-minded, so they sort of delay, you know, that is the current trend right now, you know, and as you mentioned, at that age, at 40s, they might be having other complications like diabetes, hypertension, you know, those kind of obesity and all that, so on and so forth. So what is your advice for people who are conceiving? Apakah nasihat doktor untuk wanita-wanita yang berumur 40 yang ingin mengandung? What kind of plans they should take, or what is your advice for them?
Right. So for those who are of older age, right? You see you're 35 and above. Okay, you want to plan to conceive a child, or you have plans to conceive a child, right? Then do take note that do not delay your time too long. Especially, let's say, if you're already at 40 and you decide, okay, I'm ready to start a family, right? So since you're ready at 40, you know that it's not going to be a very easy journey, right? Probably you want to go and see a doctor fast, assess your situation and your partner's conditions. Then if they're able to help you, they will definitely, at least you have your options, right? If let's say you're younger, you're 35, you say, okay, I plan to conceive in a year's time. So you can, you still have some time, right? So depends on your age, when you plan, right? If the older you are, then I would say, don't wait too long. You need to seek help or seek professional help faster, so that your doctors may advise you on what is the fastest way of getting you pregnant. Because the younger you are, the easier to get you pregnant. The older you are, your journey may be longer and more difficult.
Apart from medical intervention, Dr. Liza, what are the things that women can do on their own to improve their fertility?
My best advice is to keep your body healthy. That's one, right? Because a lot of us now, we are so dedicated to our work that we fail to take care of our own self, right? So then we say, okay, never mind, later on, I can seek help. But whatever it is, it starts with you taking care of your own health. Back again to your diet, to your exercise, and your lifestyle. So these are the 3 things that you must first do to take care of your own health. Of course, you can also improve it by taking supplements, like I mentioned earlier, to help you along the way, right?
Okay. And is there any home remedies that you will recommend as a medical professional for all these women over here today? Home remedies, if you're all into home remedies, if we don't want to take medicine. So that is one of the famous questions. Is there anything I can do at home?
Yeah, okay. I know that a lot of home remedies out there, okay. I'm a person who don't really advise home remedies. You can try them. I wouldn't say no. They are usually, I wouldn't say that it's harmful, right? But we will try them, do try them in moderation. Don't do it in excess. Okay, I've heard of people, some people say they actually tried eating bean sprouts like 1 to 2 kilos a day, raw one. Okay, so I think that's a bit too extreme. So if you can try, you want to try home remedies, go ahead. I have none that I have to give you, but do them in moderation. Yeah.
Okay, thank you. So I hope that's clear for everyone. Whatever it is moderation. That's the key word today. All right. And how about traditional Chinese medicine? Does that help with female infertility?
Okay. TCM does play a complementary medical treatment here. Even I sometimes will refer patients for TCM. Okay, those who feel that they want to try an alternative treatment. Okay, because some patients will feel very stressed out when they see doctors only give them medicine and injections, right? So whereas for TCM, they have a different approach. So for me, there are studies that shows that yes, TCM do work, right? But do know that you will need to go hand in hand with your doctor, okay, for your treatment or whatever treatment you're doing. Okay, some people do rely on just one because they feel comfortable. They feel comfortable with TCM or they feel comfortable with Western. Some they feel comfortable with both. So I wouldn't say there's any harm doing it, right? And there are studies and data that shows that yes, TCM do work.
Okay, thank you. Now I got soalan cepumas for you. This one is very famous question also. Now that the whole country is being vaccinated, does the COVID-19 vaccine affect fertility? Kalau saya ambil vaksin COVID-19, ada tak saya punya, kalau saya mengandung, ada efek baby ke atau affect my fertility? Ada tak?
No, it doesn't. All right. My advice is go and get yourself vaccinated. All right.
Okay.
COVID-19 vaccine does not affect fertility.
Okay, right? Thank you. So
if you're pregnant, then it's different. If you're pregnant, the advice is you still can be vaccinated even when you're pregnant, but it will be after 14 weeks.
So those who are pregnant, selepas 14 minggu mengandung, baru ambil vaksin COVID-19. Orang yang belum lagi mengandung, please can go and take. No problem. All right, doesn't affect fertility. Okay. So what is your advice to all the women out there who know or suspect they are infertile? Apakah nasihat Dr. Liza sebagai pakar kepada para wanita yang tahu atau mensyaki diri sendiri mempunyai masalah kesuburan?
Okay, if you think that you may have problems conceiving, right, my best advice is you have to go and see a doctor, right? You have to get it checked. A thorough check means pemeriksaan, investigasi, then you know the root cause of it. Apakah punca tak kesuburan tu, right? Rather than going a big round, like what Chachini earlier said, Dr. Google, right? So the best person will still be your doctor.
Okay. All right. Thank you, Dr. Liza. I'm going to take a few more questions from the audience. Is that okay, Dr. Liza?
Yeah, sure.
All right. So this is from Alan Lau. Mild stimulation and hormone growth injection. Which one gives better result for women age 42?
I would tend to think that he's asking about IVF because normally we do mild stimulation in IVF, right? That's bayi tabung. Okay. So for women who's already above 40, depends on your egg reserve. Okay, if your egg reserve it's still good, you have a lot of eggs, then sometimes mild stimulation may not be of the cost effectiveness of it is not there. But if your egg reserve is not that high, you're going to be producing very few eggs, then mild stimulation may be a better, a more suitable one for you. So it still depends on what your condition is, because it's not one medication or one treatment protocol that fits all. You need to tailor that protocol to your needs. Yeah.
I think that was an excellent idea. There is no one mold that fits everyone, right? So you got to tailor it to the specific patient. All right. Thank you so much. This is from Sally Ibrahim. Is there a specific food to increase the chance of fertility? Dr. Liza, what can I eat to increase my fertility?
I wish I have that food for you, okay? But unfortunately, I don't have advice for that. There's no one food that has that magic. Probably in future we may have it, but currently no. Yeah.
Okay, so Sally, sorry, just eat fit. I mean, eat right and stay fit. I think that is the best advice, Dr. Liza. I'll give you no specific menu you can take for increasing fertility. There's another one, Asalina Azman. Hi, doctor. If late ovulation like a week or sometimes 2 weeks after the day supposed to ovulate based on the calendar, okay? And does this situation relate to infertility?
You may have some problem because your ovulation times takes longer than the usual. If a normal woman, normally it takes about for 2 weeks. Okay, so if yours is delayed, it shows that your egg tend to take longer period to mature. Okay, so if you can catch when is your ovulation time every cycle, then it would not be a problem. Like I think she did mention about using ovulation test and OPK, right? So she can actually practice that. But sometimes when you first start doing the OPK or ovulation test, it can be very stressful because your app says that this day, so you start doing, and every day you do, you see a negative and negative, and every day you see negative, you get very depressed, right? So, but do be more patient because sometimes you will see a positive. Unless you're a person who do not ovulate, then you will never see a positive. So how will you know that you don't ovulate? You still need to go and see a doctor to check to see whether your egg is actually growing, right?
Okay. And this is from Jin Eng. If a young couple feels that pregnancy isn't happening, we try for several months, okay, but they feel it's not happening. What should the thought process be in terms of first step? What should they do the first few steps? And how do they get started on their journey to get help?
Okay. The first few steps that you want to know is whether you are ovulating for your wife, and I mean for the female. And number 2 is whether your sperm is good. These are the first 2 things you want to know. So how you want to get this checked? You will need to go and see a medical professional to have it checked out. Yeah.
Okay. Dr. Liza, this is from me actually. I think most Malaysians are having this problem. Stress. Now we are under immense stress. PKP lah, MCO, and then, with all the economic crises and the COVID outbreaks, and, everybody is under immense stress. Does that lead to infertility? Does that cause infertility?
Yes, stress do have some impact on fertility, right? The studies that shows that if you are really stressed and increases a certain enzyme or chemical in body, it does affect fertility. So the answer to it is yes. How do we reduce stress? It depends on you, really.
Yeah. Okay, so guys, stress does cause infertility, okay? So no more stress. Go and watch some comedy or something, de-stress a bit. It's not worth it, okay? All right, Dr. Liza, last question for you. What is your advice to all the women regarding safeguarding their fertility? Apakah nasihat Dr. Liza kepada semua wanita yang perlu memelihara kesuburan mereka?
Okay. I know you've heard this, you've heard me saying this a lot of times during this webinar, right? If you want to safeguard your fertility, you must have a healthy lifestyle, right? So that starts with you. Means you maintain your good body weight, you maintain a good diet, right? You keep away from smoking, right? Alcohol if you can, right? Not excessive alcohol. And if you think that probably you will be a person who will be more career-minded, that you will delay starting a family at a later stage, right? Do know that what are your priorities when you're ready to start your family, if you think that you need help, go and seek help earlier.
Okay, Dr. Liza. Is it okay you take one more last question from the audience? Everybody's like so eager to ask. Thank you so much. This is from Kogila Jayaraman. Doctor, other than Fertility, is there any other supplement or food that can increase sperm quality and quantity? Very specific over there.
Yeah. There are other sperm, those supplements for male fertility. Okay. Fertility is one of them. There is Tribeston, non-natural. There's also spearmint. Okay. So these are the other types of supplements for male. There are also other like Cervex. Cervex has zinc. They have CoQ10. They have arginine. So like I said, the other brands, they are broken up. So you have CoQ10 there, you have arginine here, then you have other components. You can still take them, no problem, right? If you think that Fertility does not work for you, you can always try other brands, because do understand that not all medications work for everyone.
Okay, all right. Thank you so much, Dr. Liza, for that very, very enlightening session. Thank you for answering all our questions. It was amazing.
Thank you for having me. Yeah.
It was amazing. I think all of us got all our questions answered, and this was a very, very important topic. So thank you for your patience and answering us in detail. It was amazing. I think personally, I learned a lot. So a big shout out to TMC Fertility and also Dr. On Call for coordinating this whole session. Thank you so much, ladies and gentlemen, for being with us until the end. For those of y'all who want to be in contact with Dr. Liza for a personalized one-to-one session, you can click on the link under Dr. On Call there to directly contact Dr. Liza and further ask her anything regarding a fertility issue or conceiving, or how to conceive, and so on and so forth. Okay, guys, thank you so much. Signing off from you today is Dr. Sashini. I'll see you next time. Thank you, ladies and gentlemen.
Bye.